Hello, this is Dr. Cieri-Hutcherson. Today we're going to be talking about Transitions of Care Activity 3. So this is the third in the three-part series in PHM 616 on transitions of care for inpatient. First, you can click into weeks 9 and 10 activity and go to the Transitions of Care Activity 3 class plan. So we'll go through this, and then we'll also go through some of the other materials posted on UB Learns that you'll be able to use to prepare for class. So class is either on March 27th or April 3rd. Again, according to your group number, you'll either be reporting at 8 a.m. and slightly different to past classes, 8 a.m. or 9:30 a.m. So this class, Transitions of Care Activity 3, takes a little bit less time, so that's why the times are different. So please make sure you're reporting at the right time. So you'll come to Copord 250 at your designated group time. Make sure you wear professional clothing, lab coat, and name tag. And first review the goal of the activity. So you'll be using the MUST, which is an acronym evaluation tool on patients who have already been discharged as part of a transition of care follow-up, and perform a follow-up phone call on those patients to address any patient concerns and make appropriate referrals to other healthcare providers if needed. So first, you'll start by filling out the MUST post-discharge evaluation form. So again, you don't have to print this. It will be provided for you in class. This is here for your reference so you can see what it looks like. You'll start by putting your name on the top, and then you'll be calling a patient in front of you to fill out some of the information to determine whether or not there are any concerns that the patient has, or any concerns that you have as the pharmacist, or any referrals that need to be made to other healthcare providers. So you ask a series of questions to determine if a pharmacist intervention is necessary or whether or not another healthcare provider or consult should be recommended. So when you report, you'll be given a discharged patient. So assume that this patient that's been discharged has already been evaluated by a discharged pharmacist to make sure all the discharge medications are appropriate. So you're not really looking for any type of therapeutic efficacy parameters or evaluating that. You're just going to be evaluating the patient on their follow-up phone call. So you'll be given the patient's phone number, and you'll call the patient, and then you'll confirm it's the patient and run through the series of questions on the MUST post-discharge evaluation tool. So here's an example of a note. There's a folder for different examples. So this would be an example of something that you would be given for the patient. So for this patient, she's a 78-year-old Caucasian, or he's a 78-year-old Caucasian male admitted to Buffalo General with a chief complaint of shortness of breath. Past medical history is listed there and corresponding home medications. And then the hospital course was that the patient was found to have an asthma exacerbation, was started on oral prednisone, and his fluticasone or Flovent inhaler was discontinued, and he was started on Advair in its place. And he was to follow up with his pulmonologist within 1 week of discharge. So these were the discharge home medications that should have been listed for the patient, and assume that they're already evaluated by a discharge pharmacist. So when you're calling the patient, you're going to be filling out this form. You will ask, how have you been since discharge? What's been going on? How have you been doing with your medications? And then fill out the boxes accordingly. If there are any concerns, you would want to make notes about those there. So let's say when you call this patient, you're filling out your form, going throughout the questions. The patient states that he's been using his Advair as needed since leaving the hospital because that's how he used to use his fluticasone. So this would be a concern, as this should be a twice-a-day medication. So under pharmacist intervention, you would list how are you doing. Either you could list it under how are you doing with your medications, or may I go over them with you, and do they adequately describe the medication list. So that would be something that you would want to intervene on, that the patient doesn't know how to take their Advair and will require further counseling on the medication. You go through the rest of the questions with the patient, and he also states that he no longer drives, so he's not really sure if he's going to make it to his appointment with his pulmonologist. So when you're filling out the MUST post-discharge evaluation tool, you would mark that as either 8 or 9. It could be either. Do you think you will be able to make it to appointments? He's probably having a concern because he doesn't drive. He doesn't have transportation. Maybe he can't ride the bus, and so maybe the concern is there. So either under 8 or 9, you could list the patient's concern with being able to drive. There might be other concerns that you have as a pharmacist as you talk to the patient, so just make sure that you check the appropriate boxes and put any notes about what the concerns are. If you're going to recommend a pharmacist intervention, make sure you check this box. And if you're going to make any other interventions to recommend referral to other healthcare providers, then you'd want to check those corresponding boxes. So for this patient, you would want to make sure that social work has a referral, but none of the other healthcare providers have a referral. So the patient didn't need a psych consult. We didn't need to talk to their primary, and there aren't any other notes about any other healthcare providers. So if you aren't recommending a referral, you would want to make sure that you don't check those boxes. So if we go back to the discharge instructions, this would be an example of that patient's post-discharge form filled out. So you talk to the patient, he says he's been doing okay, you don't have any concerns. When you evaluate their medications, he says he's been taking his Advert as needed, RPH intervention to counsel on use. So this would be your notes that a pharmacist intervention is required, and you've checked this box. You filled out the rest of the form, and then either 8 or 9, the patient no longer drives, he's unsure how he will get to his appointment, and a social work referral is recommended. So pretty straightforward, pretty simple. If we go back to our class plan, you'll have about 15 minutes with the patient to interact with them on their post-discharge follow-up phone call. And once you've completed your form, you can have a little bit of time to fill it out further after the patient encounter if you require it. If not, you can turn in your form when you're done with it, and then you'll be evaluated on accuracy and identification of those clinical issues. So whether or not the form was filled out correctly, and whether or not you were able to identify, asking these questions, what the issues were, that the patient wasn't taking their Advert appropriately, and the patient doesn't drive, so they're not sure how they'll get to their appointments. We'll just go back to UB Learns. So the class plan is listed here. Closer to the date, a student-specific schedule with specific times of what rooms you're reporting to will be listed, so make sure you check back before March 27th or April 3rd. The MUST post-discharge evaluation form is a form from the Medication Management and Care Transitions Best Practices, so you can look at the MUST post-discharge form there. And then make sure you review the examples prior to attendance of class so you know what you're going to be seeing in terms of the discharge note and what you should be evaluating on your post-discharge evaluation form. As always, if you have any questions, you can contact me. The best way is going to be by email. Otherwise, the instructor for these classes or facilitator is going to be Dr. Slazak. So if you have any questions that day, make sure you talk to her, or any conflicts, and make sure you wear a professional dress. Thank you.